Well, look at us here at the end of March already. I don't know where this month went. I do know that I was on 7 different flights. Yes. So I'm just getting readjusted. We're back home and diving right into taxes. But anyway, it felt good to hop on and record this episode, sharing the essence of what's happening in doTERRA right now. We just got home from leadership retreat. There's pretty incredible stuff shared, but there's a lot going on and there's a lot of growth coming, and I wanted to share it with you. So I hope you enjoy. Welcome to Whole Fit Talks. This is a show just for you, somebody interested in taking ownership of your health, leading your life, and living your legacy. And I'm so pumped you're here because I am another you. Thank you for being here, and thank you for sharing this out with your friends and with your teams. Let's dive into this week's episode. Right on. Well, welcome to Whole Fit Talks. As you guys may know, if you've joined in before, this is a live broadcast that I do on the last Wednesday of every month. Sometimes we have a theme. Sometimes we just do hang time together, Q&A. We talk about health. We talk about business. We talk about being moms. We talk about leadership. Lots of good stuff. But today I do have a topic. We're going to talk about what in the world is going on in doTERRA. What is happening, in this movement? How is it changing, and why have we only just been getting warmed up? We're going to talk about some things that happened at the leadership retreat. So if you were there, let us know in the comments if you were a high-level leader who was at this retreat along with 8,000 of us. Then I'd love for you to join in this conversation and share your perspective on what was shared. If you're here for the first time, I would love for you to share this out. If you have friends that you think might be interested in this conversation, if you have teams that enjoy these topics, feel free to click the share button and share it out, whether you're on Instagram or Facebook. And as you guys may know, I do upload this to iTunes and Stitcher and I believe SoundCloud. And all of the episodes you can find on wholefit.com/podcast. So if you're ever looking for one from the vault, you'll find them there with the show notes. So I like to start off the monthly podcast when we're here together live, reading a review that was left over on iTunes. Thank you, all of you who have hopped over and left reviews. I read them all. They are so meaningful to me. I show up here for you. I love these conversations together. So when you leave a review over on iTunes, it actually helps other people find the show. So if this is a conversation you think more people would like to be a part of, please hop over and leave a review. This episode's review comes from Andy8535. Andy, I don't know your real name, but that is your handle. He said, I love Ange. I love every single, I shouldn't say he, it could be a she. I love Ange. I love every single one of these podcasts. I'm not someone who's growing a doTERRA business, and yet these podcasts help me so much. She's as real as it gets and gives tangible action steps to level up in our lives and create a life we love. I just love this podcast so unbelievably much, Ange. Thanks for showing up each time and leading in such an awesome, authentic way. Thank you for that. We'd like to tangibly thank you for that by hooking you up with a 50% off promo code off any of my programs. So if you could please email my assistant Jill at teamwholefit@gmail.com, we will hook you up. I love that Andy listens in even though he or she is not building a doTERRA business. Because as you guys know, I'm the leader of a large global essential oil team. I've been building doTERRA now for 5 years. It is much of the work that I do is in that realm. But what I have learned over the 5 years of building doTERRA is that what's happening in doTERRA is a micro version of what's happening in our world. And a lot of the lessons I've learned along the way, a lot of the growth, a lot of the insights as a leader in a big scale up business, what I've learned is applicable to you no matter what industry you're in, no matter where you are, because really the core of this show is about taking ownership of your health, ownership of your life, your business, your success, your results. It's up to you. It's not up to anybody else. And if in this hour together, once a month, you can have a little bit of a shift in your perspective of how you do that. And you realize there are more people doing that with you. I want you to leave inspired to keep crushing it and to keep modeling what's possible when you truly take ownership and are not waiting around for someone else to do those things for you. And to be honest, if you are building doTERRA, what I've noticed in my own team, and I have a lot of friends in doTERRA who have big teams as well, here's what we notice: the only people that grow are the ones who get this. So if you are somebody, if you're a human being right now out in the world, you love the idea of taking ownership of your health, you love the idea of being more connected to the earth, grounding in, really taking the upgrade in your health, you would actually love building a doTERRA business, because that is all we do. And then we just help, we do that for ourselves and we help other people start, and that's it. So before we go in, I've been doing my taxes. Anyone else? It is that time. You know, every year it gets better because I get smarter with it. But in a business that is always scaling up and evolving, all of the processes do as well, right? So I don't think you ever really get to that level unless you're not growing. You don't get to that level where you're like, oh, this is easy, I've got this. You know, the more you grow, the more help you need, the more complexities there are, right? So I've been wearing sweatpants for the last 2 days, just going through it all and preparing my financial statements, and gonna get that all locked in tomorrow. But I wanted to let you know that as I've been going through this process, my plan is to release 1 or 2, depending on how long they are. I wanna keep the podcast shorter. So depending on how long they go, I'm gonna release 1 or 2 specifically on the topic of finances and growing your wealth. I'm going to explore a little bit about how our wealth evolves the more our belief in ourselves evolves, always. That's like step 1. But then also how to manage it as it starts to circulate and come in, and how you can circulate that in an intentional way, you know, and just being really smart. And something I've modeled for my team from day 1 is you have got to know your numbers. If you are growing a business, you have to know where you are circulating energy in your business. You need to know your numbers to grow them. You really can't set goals on the last day of the month. You really need to understand the story of your business through your numbers. And I certainly do have leaders on my team, even leaders of really big teams on my team, who they give that to someone else in the house. That's fine. But at some point, honestly, and I'd love to encourage you women especially, because typically I see that it's men who are more drawn to this work of understanding the numbers. I want to encourage you as women to really understand the story of your numbers. And maybe this year is your time to grow, because you're having a real good, honest look at what your business is telling you, and you know your numbers, and you're growing your numbers, and you're that chief financial officer in your business. That's what I want to encourage you to do through the podcasts I release this month. So I hope you like them. I'm actually going to also share with you a real easy template for tracking where your money is circulating, okay? And the cool thing is, if you're in doTERRA, you have one of the greatest opportunities at your fingertips to grow a business model in addition to what may be your full-time job right now, but you're growing something that's going to take care of you your entire life. And that's a really important decision to make. We have more and more millennials joining our team who are right out of university or didn't even go to university or college, who are getting this a lot faster than people my age did. They're understanding that times have completely changed. And the way that our whole system is set up right now in business, the way the educational system teaches us to have this viewpoint of business, it does not exist. You graduate, and that whole, you know, fantasy that we thought existed about getting hired and having a full-time job after you graduate, it just doesn't exist anymore. Really, the whole thing has changed. And so you need to have plans in place to have multiple streams of income. That's just the way it's going to have to be. And so this conversation I share with you through the podcast will definitely speak to you if you own a business or have the opportunity to grow a business stream with something like the doTERRA opportunity. All right, so a few quick updates just on my program. So the Beautiful Life Lab has been rocking on now for the first couple months of the year. I just want to let you guys know that you can join in that lab at any time. I do a quarterly Zoom mentoring session with about 300 of the students in the lab. It's an upgrade of $100 if you want that. And we have our Q1 wrap-up session this Sunday. So just letting you know, if you want to join us, now would be a good time. I have a lot of students. We have about 2,500 students in the lab. A lot of them joined us when the program launched in December, and January and February kind of got the best of them. They couldn't quite get into the processes of eliminating the noise in areas of their life. So just a quick snippet of that. You can certainly go over on my website and read more about the program, but the intention of it is to give you really practical ways to work with systems that are meant to be efficient for you, such as your cell phone, such as your laptop, such as your calendar, your inbox. So what I teach you is how to reduce the noise and all of those things and really get them working for you so that you can actually create movement in your goals. And I take you through the process of visioning your year and how to micro that down into quarterly goals, how to develop a daily ritual, a weekly plan. It's really the nuts and bolts. This program was born because of you guys, because for years and years, I've been living these principles within my own work life. And as my business took on huge scale, as it grew rapidly over 5 years, I would have completely burnt out if I didn't have these systems in place. So I teach you it all. Nice to see some students on that are in there. Ashley, Katie, Tara, awesome. So yeah, if you want to join, you can go over to the website, you'll see the link, and you can join the Zoom calls, which happen at the end of each quarter. So just want to give you the heads up there. Also, Ready, Set, Glow, my biannual detox, which is open to anybody. It's a 7-day detox. The next date of its run is April 22nd to the 28th. So if you're already in there, you don't need to do anything. You're in for life. But if you want to join that cleanse, we have a couple thousand people in that group, and it's juicing and whole food nutrients. It's really cell nourishment for 7 days with lots of great community support, lots of recipes in the ebook, and additional detox rituals you might want to take on, like dry skin brushing, and oil cleansing, and oil pulling. I go through all of that in the program for you. So we'll pop the link up in the comments, or you can go to my website and just look at programs. You'll see it there. Okay, last two things that I want to get into this conversation. So both of these things are doTERRA related. If you are a health coach, health influencer of some form, if you've been curious about doTERRA and wanting to try the oils and share your experiences, and you're not yet using doTERRA, I would love to connect with you. So I'm going to put a link up. There's a health influencer form that we're going to post on Facebook for you. It's wholefit.com/health influencer. I want to meet you. If you have wanted to try the oils and share your experiences, and also have the opportunity for me to teach a one-on-one class to your community, then let's connect, okay? The other thing I wanted to let you know is if you're not using doTERRA and you want to explore trying doTERRA for a specific health goal, I'm starting up these new oil focus groups in the spring. I'm going to take on 5 people for each focus. So whether your goal is to have better digestion, higher energy, maybe you want to sleep better, maybe you want to work on your skin and have that glow, pain, whatever your focus is right now, I'm going to create these little sets for these oil focus groups where you can purchase at a very low cost the oils that you would need to focus on that for 2 weeks to see what shift you have, okay? This is only, again, open to people who aren't already using doTERRA. If you already have doTERRA, you have access to it all at your fingertips, obviously. So if that interests you and you're not using doTERRA yet, please add yourself to this list we're going to pop up. It's a bit.ly/DT interest, okay? All right, enough of that, enough of the updates. So I want to talk today, and I want to hear from you that we're at the leadership retreat last week. You're probably still trying to get settled at home. I am as well. Lots of travel last month. I actually calculated I was on 7 flights in March. What month are we in? Anyway, it was a great month, and it was really a team-focused month for me. I was with all of my team in San Diego and in Atlanta for these leadership retreats that doTERRA does. And next year, we're actually coming all together to do one leadership retreat, but typically up until now, you've had the choice of two, going to East Coast or West Coast because it's gotten so big. So even if you're not in doTERRA, you guys, I would love for you to stick around because I think it's really interesting what is happening right now on the health front. Okay, so I think that, let me just find my notes. 1 second here. If there was one core message that everyone went home with, and this was actually, I had the honor of speaking on the main stage at both events this year, and this was the topic of my talk even before I got there. Obviously, you have to submit your talk weeks in advance, right, when you're speaking on a stage. And it was so goosebumpy to me to have created this topic that I spoke about how we are entering a new era. And you come to leadership and you realize, wow, are we ever? I think the last 10 years, doTERRA, there's been a lot of movement, right? Tons of growth. And you may think that doTERRA has hit its peak or that it's saturated, and they're like, honestly, that could be further from the truth. They're just getting warmed up. I really think the last 10 years has been a warm up to this next super big phase, this next wave of growth. That's right. I see a lot of you commenting on that. So what I took away was we have the opportunity right now to witness one of the most visionary brands in the world today illustrate how they take vision to the next level. And I love the owners in doTERRA. There are 7 of them, which I super love, that it's not one person at the top making decisions. There's a real team. And these 7 owners, the whole time, even though I joined 5 years ago, so they had already been growing doTERRA for 5 years. When I joined 5 years ago, I felt it, and I feel it even more today. They are modeling what it looks like to dream big, what it looks like to continue to have that vision and that North Star propelling you forward. Just when you think you've hit some level of success, I mean, doTERRA could quit today, and their story is epic. Right? The movement that has happened in over 7 million homes around the world, it's huge, right? But they've shown us that, oh, no, that has been the warm up. So I want to share a little bit about what's happening in healthcare. I want to share why doTERRA is one of, I know there are other amazing companies out there that within their own focus and niche are being a huge solution in our world today. They're creating positive impact, not just change, but change on a very positive global level. That is really the call of great companies today, is to stay in their lane and be the best at what they do. And this is what doTERRA does. Just like there are other companies, helping on the world hunger front, or on clean water, or on creating a healthier planet through eliminating plastics. I mean, there are so many companies that are hyper-focused within their niche. What doTERRA is hyper-focused on, and will always remain the dominant company in, is natural healthcare, okay? So what we're witnessing is this next chapter is about to unfold, okay? And doTERRA, as much as it's had this growth, right? So there are over 7 million homes around the world that use oils. They understand their responsibility to define essential oils now within the medical community. How many of you have heard your doctor, perhaps, or nurses, or people in your life who are involved in the healthcare industry say, well, show me the research? We do live in a world where you have a very small population of people, I would be one of this group, who do not need research to tell me what I know, okay? I will never say, show me the research before I try something. If I am intuitively guided to use something because it's in alignment with my beliefs, it's in alignment with my vision for what I believe to be true, I will try something and will never ask you for the research. But I represent a very small population of our world. The majority of our world says, show me the research first and then I'll try it. Even though everything committed to doing right now with this white knuckle grip is failing them, even though the things that they're using, so loyally have all of this research about being an effective approach. Even though it's hurting them, they will stay in that model until you show them the research for a better way. And this is difficult to understand. When somebody is hurting and broken and yet so closed off to what is a very viable option for them that's not as harmful, more natural, it's just kind of, the way that things go right now as we move out of this early adopter phase into the next realm. So what has been needed in order for this next chapter to unfold, to move out of early adopters, small percentage of people, like 2 to 3% of people in North America using doTERRA, what is going to be required for it to go into the next 10% is it's going to need to be recognized by the medical community. It's going to need that credibility that we already know that it has. And there's already tons of doctors, there's hospitals all across the US that have been integrating doTERRA and looking for ways to create small micro solutions to problems within that model. But we're going to be seeing a lot more change happening in the next few years. I'm going to share some stats with you. I want to drop this quote on you that I heard Dr. Joe Dispenza share. I heard it on a podcast a couple of years ago, and it always stuck with me. In the age of this much access to information, ignorance is a choice. This is a really good way to understand what's happening right now. Ignorance right now is a choice because there really is, you just cannot say anymore unless you don't have access to a device and Google. You really can't say anymore, I just didn't know, right? We know more than we want to know about what's going on. And depending on the people and the groups that you surround yourself with, you're going to get dripped with different perspectives. If you're in groups with a lot of people who are sick and unhealthy, but very committed to broken models, you're going to get that perspective dripped on you all the time, where you will tell yourself stories about what's happening that maybe aren't true. If you have people in your life who are warriors for a new way, who model it in their life first, who are the early adopters, who model change for you, you're going to be much more open to exploring that in your own life. And what I love about the online community, you guys, is again, we can't say, I didn't have those people in my life, because you can choose who to surround yourself with. You can choose to show up here and be around the thinking of higher level thinkers. Even if in your local area, you're surrounded by people who are committed to staying stuck, you can choose to shift your perspective. But that really is the deal, right? Ignorance is a choice at this point in our life. So why is doTERRA going to be one of the biggest solutions to our current healthcare crisis? We have to understand health right now, the whole model is broken because it was really built so that 20% of our needs would be treated and dealt with in hospitals and with our doctors. But unfortunately, what has happened is people are taking 80% of their needs to their doctor. There's a reliance right now on doctors and on the system and on healthcare in general to fix everything for us, as if it's their responsibility. And this thinking is going to have to shift, or disease comes in. With that thinking, we can't grow in our health, right? And so we have to come back to a place where 80% of our healthcare needs are being handled through the level of self-care that we take of ourselves. 20% handled through proactive medical care. That is when the model works best. And the model is incredible. We are so lucky. We are so lucky to have access to the type of care that we do, if it is respected properly. And unfortunately, it is so inundated right now in numbers, in wait times, in insurance companies finding their way into the access, right? There's just, it's become a very convoluted dark situation because we just can't get the care that we need. Now, there's going to be groups, like I've said, that they're going to take a white knuckle grip to this system and the models that are hurting them as change starts to happen. There are people who have been disempowered by health and wealth agendas for a long time. They don't realize it. And they're so committed because they've been beat down by these models. They've been told their whole life this is the way. They're going to have a real hard time, and they're going to get louder. One of the things I shared from the stage at Leadership Retreat was that resistance is always going to happen as that next breakthrough happens. So I want you guys to understand something. If you're building doTERRA, if you're modeling a new way, a better way, if you are the example of what happens when you take good care of yourself, get ready. People are going to get louder who are not committed to that way, okay? And they're going to come at you. If you are an example of what is possible, rather than people taking responsibility and going to the systems and the agendas that have hurt them, it is easier for them to come to you, okay? So you're going to see a lot more of that happening. However, we're getting louder too. And being an example of what's possible always is the mic drop. It doesn't matter what people say or what they try to throw at you in terms of stats and research. If their life is not an example of what they are throwing at you, you just don't listen. Why does that carry any weight at all? I mean, it is the first, in fact, I have a real hard time, Chris and I talk about this all the time. We have friends who are our age, mid-30s, early 40s, who don't have kids. And when they start to talk about how busy their life is and how they just don't have enough time to get things done, it doesn't quite fall on compassionate ears, because until you're a parent and you have had to walk out night after night worrying about another human being that you've brought into this world, you just don't understand. You can't fully understand what that responsibility feels like, to not just be thinking of yourself in most situations. And when I think of people coming at the health movement with these dark agendas and judging and tearing people down, I'm left with no choice but to look at their life. It's all we can do. We have to look at their life, and if they are not modeling light and love and true health and well-being, why are we listening? Why are we giving them any space up in our minds? And this is what's really going to be happening a lot more. You have to have discernment with what conversations you're entering and with who, right? So doTERRA, I mean, the growth that they've had that we've just talked about has been big, right? I mean, they've been compared to Apple and Google in their early stages. They're the largest essential oil company in the world today. And there's a lot of reasons why they will continue to be. But the reason there's a couple of reasons why they're in such a position to truly change this model. There's a lot of companies doing good things, but they're small scale and they're not built for sustainable growth. So they can't quite have the impact globally that doTERRA has the opportunity to do. So as the world's largest essential oil company, there's hundreds of other essential oil companies out there, right, guys? I'm seeing, I saw someone comment earlier over on Instagram saying doTERRA is overpriced. I've tried it. The claims they make regarding healthcare is simply opinion as a marketing strategy. So Nicole, I appreciate you leaving a comment and not hiding behind a profile, because the thing is, your comment is a legitimate thought that people have, that doTERRA is overpriced, or that what they're doing in healthcare is just marketing, or that their quality testing, the CPTG label, is just their own term. The thing you have to understand is you have to know the heart of a company and the vision that they have and the mission that they have, to then look at all of the things they're doing and you see it through the right lens. So oils being overpriced, that's a good example of somebody that will not try this way without weighing in what's actually happening in this industry. So doTERRA's oils are not overpriced. The reason you can buy a bottle of 100%, quote unquote, air quotes if you're on the podcast, the reason you could buy 100% pure frankincense oil at the dollar store for $3 or at Target is because you're not buying frankincense oil. And so Nicole, you feel doTERRA is overpriced because you're comparing it to something that is not essential oil. When you have proper sourcing in place, when you're not ripping off the countries that are providing these incredible plants to us, because some companies, they're not charging $3 for frankincense, they might charge $15 for quote unquote 100% pure frankincense. They may actually even go and source it in Iran or in Somalia where it grows. They may go do that, but then they deal with brokers and middlemen, and they cut the growers out of that fair trade price. They cut them out. They completely underpay them. And then they take that, what was a frankincense oil, and they cut it with synthetics. They have professionals who can make an oil smell like frankincense without being frankincense. How do you think you can make jelly beans smell like anything in the world? This is what happens in the industry, you guys. It is unfortunately a really dark thing going on in the industry because doTERRA has elevated essential oils in the category. You see all of these companies launching essential oils now, but they're not essential oils. If you go and take them to be tested, you would realize that. So it's not that doTERRA is overpriced. It's that what you're comparing it to is not real essential oil. Okay? So we have to really check in with our stories. Okay? And I'm totally, I mean, thank you, Nicole. And I welcome your comments. I love to have this conversation to help you understand. You know, we have to challenge our perspectives at times, right? We have to really ask, well, is that the right way to be thinking about this and what's happening? So doTERRA being the largest essential oil company in the world, they're debt-free, which is really a very important thing. They are privately owned, which is the most important thing. And the reason for that, you guys, is once a company becomes publicly traded and owned, they are not making decisions based on their moral compass anymore. They're making decisions to satisfy pocketbooks and lobbyists and Wall Street. And so there are very few companies like doTERRA who are billion-dollar companies, being the world leader within their niche, who are privately owned and who can continue to make decisions based on that North Star, that of doing the right thing. They also, on a global level, you guys, there's over 3,200 employees within 16 offices, within 16 countries, sorry, around the world. So doTERRA is a global brand. You may be living in the US or Canada or Australia where there's been a lot of growth, but this is now like worldwide, this is happening. Because everybody is interested in having better health right now, right? So they've done an incredible job with the sustainability. I mentioned that in regards to Nicole's comment about pricing. doTERRA is really the only company who has the potential to take essential oils into every home around the world because of the model, because of the way that they source the oils, and because of their commitment to doing it in a sustainable way. Other companies who have popped up in the last few years just for profits, they're going to fold or go bankrupt in the next couple of years because they don't have a plan in place. And as the public, as you guys become more educated in this industry and understanding quality testing and why doTERRA works when that oil from the mall doesn't, when you start to understand that and you start to put pressure on these companies for transparency of what's in those bottles, those companies won't be able to stand up to your questions. And so they'll realize that they're going to want to get out of this industry fast. That's what you're going to see happen in the next few years with that. With doTERRA's oil, so not only are they sourced globally where those plants grow and thrive, they also go through 54 different tests for quality once they are distilled. Okay, now this is really big. 43 of those are done by doTERRA. 11 of those tests are done by a third-party organization called APRC, Aromatic Plant Research Center. APRC tests oils for more than 50 other companies. So they are the company that an essential oil brand would go to be able to share third-party testing, okay? So we have to understand this conversation. When we are talking about the essential oil industry, there really is doTERRA quality, okay, over here. And then there is the industry at large, which is full of mislabeling, putting false constituents in those blends, making things smell like oils. There's a lot of trained perfumists in the industry that can help something smell like lavender or peppermint or frankincense. You and your nose wouldn't know the difference, but your body does, okay? So this industry is very tainted. Aromatic Plant Research Center, you can go to their website, they have found through their testing that over 95% of the oils they receive have been fabricated. Now, these often aren't the companies sending these in either. It's people like you and I who will pay to have an oil tested to see what's actually in it. So if you have a brand that's not doTERRA and you're curious about this, maybe Nicole, maybe you're using something because it's cheaper and you want to actually know what you're using, pay the $200 to have APRC do a test on your oil to see what, I mean, it's worth doing, right? Because we're not talking about shoes and purses and t-shirts. We're talking about our healthcare. So you want to make sure that what you're using is actually what you think you're using. Okay, so all of that to say, this movement has grown fast, right? It's attracted the right leaders. And you may have noticed this already. If you look across doTERRA at the highest levels, you know, if you look at leaders of organizations within doTERRA, doTERRA has attracted people who are taking the highest level of ownership for their health, for their success, deep responsibility within this company, you guys. People who are modeling what they teach. There is zero hype in doTERRA. You don't see the leaders in doTERRA all flaunting their private jets and their cars, because it's not about that. It is about making a true difference in people's lives. And they model that at the core. At the core. You will not see a leader grow in doTERRA if they are not modeling what is possible in your life when you take ownership. I've said this already a few times. This is kind of the theme of this month's show. And some of you, myself included, you've had leaders quit this business, right? And I want to tell you what's up when that happens. These leaders were not ready to take the personal responsibility that this movement requires. They were not ready for more. You have to have a good relationship with yourself and your self-care. You have to be very committed to staying in your lane and living your best every day, growing in your health every day. You have to be committed to that in order to be given more. And so leaders that have quit in doTERRA, they were not the right leaders meant to take this movement forward, bottom line. And on a very basic level, when you have people who quit on this work, it's because they decided to take a pause on their self-care. That at the very basic level, that's what is up. They've stopped using their oils. They've stopped. They made this about something it wasn't. It might have been about their own success, their own growth, and it not happening fast enough for them. If they had shifted their perspective to focus on other people and all of the people out there that are hurting and being an example of that to people, they would never quit. Okay, so that's what's up when you see that. But there is a whole movement of leaders who have grown into this business in the last 10 years who are now buckling up, getting ready for the next phase of growth, for that next chapter. And doTERRA as a business is going to triple over the next 5 years. So it really is, if you have any interest really in being part of the healthcare solution, I mean, I'm talking to those of you that are health coaches, nutritionists, personal trainers, for example. You've maybe been in that industry for decades and you realize it's not serving people anymore. It's not just about nutrition. It's not just about moving your body. This is about connecting people back to their own trust and power and not needing you. I posted this last week. The reason I got out of that industry, you guys, is I did not want people to need me in order to be healthy. I wanted to plug them into a lifestyle and way of leading themselves so that they could truly grow, right? We're not growing when we need people constantly to help us stay on that path. I mean, absolutely, community is important, but when we're giving all of our health over to an individual, we can't grow from that place, right? So this is who is coming into doTERRA now, are the ones who are ready to integrate and bring more of those pieces together for their clients, for their communities. So you'll see doTERRA, they're a $2 billion business right now. They're gonna go to 10 billion in the next 6 years, 5 to 6 years, okay? So right now, I think it's 8% of people have heard of doTERRA. 8%, you guys, in North America, less around the world. And only 2% are using doTERRA. That's so you can see, like, a lot of you who are building doTERRA, you think everyone knows about doTERRA, right? I'm guilty of that too. But when I travel, when I get out of my walls, I meet people all the time. People that, like, I have friends who are yoga teachers and nutritionists who haven't started using doTERRA yet, and I know they will. It's just they're taking a long time to come around to the understanding that health is more than just that one thing they're teaching. So 2% are using doTERRA across North America. There's a lot of work to do, right? So this healthcare initiative, I saw a lot of you asking questions about this when I posted the show queue up on Monday. The system right now is going to get better. Healthcare is going to improve over the next couple of years. It has taken, we've had to see numbers in a lot of areas, unfortunately, rise. 50% of people today have a chronic disease. 60% of people have multiple chronic diseases. 7 out of 10 deaths are caused by chronic disease. I mean, these are just stats that are frightening, right? And we see this happening at younger and younger levels. And you guys, 90%, and this is in the US specifically, 90% of the $3.5 trillion spent in healthcare go towards chronic disease treatment. So what obviously needs to happen is a complete 180 in our approach to health to move much deeper into the prevention side. And so doTERRA is going to reform primary care by opening up patient-focused healthcare facilities. Okay, so I want to go into what you're going to see happen, and this is, as I've been leading up to this, and as you've heard me and many other people talk about how doTERRA is moving out of this early adopter phase. This is what we mean when we say that. It's moving out of the 7 million customer base homes and into healthcare facilities with in-house MDs, in-house functional doctors who have been over the last few years very interested in being part of the solution. When doTERRA first announced this healthcare initiative last year, there were thousands of doctors who applied to be a part of it. In contrast, there would be thousands of doctors who will mock it, who will have no interest in it because, again, white knuckle grip to the system that they were tied to in school. Okay, so it's really cool what's happening, and these have already started to open. So I want to share a few facts with you guys about these areas. Some of you might actually be living in an area that's going to be getting one in the next year or two, which is super cool. So these new healthcare facilities, they're going to be called Prime Meridian. Okay, and this is a doTERRA initiative. Patients that visit these healthcare facilities are going to be treated as a whole person. Not a 6-minute visit with your doctor and his prescription pad in his hand, but an actual minimum 30-minute visit with your doctor, 30 to 60 minutes. Your doctor's going to get to know you. When I heard about this initiative, I honestly, my first thought was, wow, doctors for the first time in a long time are actually going to be seen as part of our self-care team, not just somebody you go visit when something is wrong. And I mean, thank God, myself, my husband, and our kids have not been in a hospital since they were born. However, I'm so grateful that we have that if we were to need it. But my perception and my relationship with doctors up to this point in my 39 years of life has been, I'm thankful for that person when I need them, but I don't want to need them, right? Like, that's the goal. I don't want to find myself in a hospital. My goal is, how can I take such a level of care in my home with myself and with my kids and my husband so that we don't need it? But this has me thinking about health in a different way. What if our doctor was actually somebody we visited monthly or quarterly as just part of our conversation of our health and prevention? That's what these facilities are really aiming to provide. So there are 2 clinics, and we're going to give you some links in the show notes, you guys. If you're over on Facebook, Jill is posting some links for you to check out. You can simply search Prime Meridian or doTERRA Prime Meridian, and you'll get the website will pop up for you. So that will give you more information on what, like, the nitty-gritty of these clinics. But I'm going to keep going here and give you a little bit more. So 2 clinics have already opened. There are 30 more planned. Now, this is a 5-year plan that doTERRA has to open these 30 clinics, but they said from the stage last week when we were together, it's going to move a lot faster than that. They actually also feel, for Canadians in the house, they feel it's going to move even faster into Canada. Once they start opening up in the US, they're going to move faster here. And the bigger hurdle I see in Canada is there's a perception that our healthcare is free. But it's the quality of care that is totally tanked, right? You know this if you've ever been on a wait list for a knee surgery or whatever, right? Like the quality of care and the burden on our system is so heavy here that you're not really getting that care that you want, right? So this is going to, it will attract, again, people who are interested in a higher quality of care. It would be nice if we had a choice to not pay, over 50% taxes for our free healthcare, but I don't see that changing anytime soon. So these clinics are starting to open. Now they're led by 2 main doctors. So Dr. Brannick Riggs, he's a medical doctor. He's vice president of clinical operations. So there are 2 clinics that are operating right now, as well as a healthcare facility for doTERRA employees in Utah. And forgive me, I can't remember where the first 2 clinics have opened, but I imagine that's up on the Prime Meridian website. They've also, doTERRA just recently hired a new chief medical officer. Dr. O is what we're probably going to refer to him as, but Dr. Russell Oscathor. You should look him up, you guys. He took 6 months to make the decision to come over to doTERRA because at the time he was the head of pediatric infectious disease for the US Mountain region, okay? Not affiliated at all with doTERRA. I don't even think he used essential oils consistently, really, with any kind of passion or interest when he was first approached. But through 6 months of really looking at the vision that doTERRA has right now and where they're headed, he wanted to come on and be the chief medical officer of this next new wave of growth, because he can see, he said from the stage, he presented at Leadership Retreat, and he said, it's a terrible feeling to realize as a doctor that there really is no way within the current model for you to truly help your patients. And he got tired of it, burnt out, right? Just tired of feeling like he was involved in something that was not helping people. And yeah, a lot of you are commenting on it. He gave a great presentation, and he said, 6 months later, he finally made the decision. He realized that this was going to be his opportunity to be part of something that is truly going to help people, which is why he began in the first place. And these are the doctors that doTERRA is attracting right now, are doctors who haven't forgotten why they started. Doctors who have not become jaded by agendas, okay? This is who is applying now to be part of these healthcare facilities. As patients, you guys, so let's say if you find you're living in a city that is opening one, starting in the US, 30 cities across the US, what this is gonna mean for you is obviously better healthcare, lower cost. So the cost of this is going to be at least half of what most people pay for their monthly insurance in the US, okay? So there's a big cost savings there. But with a huge focus on prevention, like I said, you're going to be able to go in and meet with your doctor when you want and have proper, lengthy visits where your whole self is being discussed when it comes to treatments. And yes, there will be obviously medical treatments, synthetic medications being prescribed, but also doTERRA oils. These healthcare facilities are going to take research rapidly forward. What doctors all across the world have been asking for is now going to happen because of these facilities. So I think the pricing, I have it written down here. You might want to double check, but I'm pretty sure this is accurate. It's going to be $99 a month for a person. $119 if it's you and a child, $158 if it's 2 adults, and $178 for a couple and a child, And then the last tier is $198 per month for a family of 4. As wellness advocates or customers in doTERRA, you receive a 10% discount at these healthcare facilities. So I'm not familiar with how insurance works in the US. I would love to hear from some of you if that does equate to less than what you're paying for monthly insurance. But this is going to be really big, and they're moving really fast, you guys. Like I said, even just in the last couple months, they've opened their first 2, and they're starting to go into all of the bigger cities. So right now what doTERRA is doing is yes, Dr. Oscathorpe graduated from McGill. That's right, Megan, here in Canada. So what doTERRA is looking for right now are the right doctors to partner with. Again, like I said, doctors who have not forgotten why they started in healthcare. And so we're going to put up some links for you, but basically the doctors need to be licensed as an MD or DO, medical doctors. So they're very strict on that. This is not open to chiropractors or dentists, etc. right now. This is just for medical doctors who are open to using and learning about essential oils and other holistic remedies. So if you are a doctor listening to this right now and you have an interest in that, you can add your contact info to healthcare.doterra.com. And that's going to take you to an application form, and conversations will continue from there. Like I said, look up doTERRA Prime Meridian, and that will bring up all the info on it if you still have questions around what that actually means. Lauren, hey, she said here in the US we pay $250 a month, but their deductible is $3,000 before insurance kicks in and pays for medical bills. Yikes, yeah. So that's just one example. Katie's saying we pay $600 a month for a family of 4, and ours is far less than many of my friends. Okay, yeah, I'm not too familiar. Robin said they pay $1,400 a month for their family. You guys, these are just 3 examples. Kelly said $700 for 2 people. So, wow. But you can see how the insurance companies in the US have really worked their way into the healthcare system and are governing a lot of that. So this is huge. This is really big, you guys. I'm not sure if you're, I mean, I know when it was first presented in doTERRA, I'm not sure the room understood what was totally happening. This is why I wanted to share this with you today, because this is really big. This patient-centric model where essential oils are being integrated for people in their healthcare as a first route. And because you're seeing your doctor more and in lengthier visits, you can explore different pathways, right? This is what we want to be able to do with our doctors. So research, like doTERRA has had a number I wrote down here. If you go into PubMed, for example, or Google Scholar, or the British Journal, what's the name of that journal? Where there's published research happening. The research around essential oils has increased by 400% in the last 10 years. You're going to see that blow up. There's going to be so much more happening just because of these facilities and again, human research, right? So we're not just talking about research that's being done in a petri dish and funded, but actual research happening, actual case studies, focus groups, with results being shared. British Medical Journal, thank you, BJU. BMJ, not BJU. So anyway, I want to wrap up this conversation and go through any questions that you have, but you're going to notice some things happen in the next couple of years. Like I said, this is going to grow big and fast. There's going to be a lot of shifts happening. You're going to see some stories start to die. When I was at the retreat, I shared this from the stage, but back about 5 years ago, when I first started using essential oils, there were a ton of aromatherapists and mommy bloggers posting content about how dangerous it was to use essential oils. Certainly how dangerous it was to use them the way doTERRA was recommending, like internal use, right? And I remember when I first started, I was added to one of these safety groups these aromatherapists ran, and it injected so much fear in me. I remember when I first started, I thought, oh, what is the right way to go here? And I ultimately decided I'm going to start just with my own practice, integrating these oils slowly. I'm going to see what happens, and I'm going to follow my gut. And what I realized through that experience, you guys, is, a lot of you are commenting, you remember that time. What I realized through that experience was we have to understand that when somebody's promoting fear around something that is truly changing lives, we have to question what's going on there. Is that truly a fear of safety, or is that a fear of them becoming irrelevant? And that's what I realized at that time was happening. And guess what's happened now? 5 years later, they've stopped talking about it. There may be some older aromatherapists out there that are still hanging on to that story, but they've stopped. The mommy bloggers have moved on. They've stopped talking about essential oil fears, or about how you should use essential oils with your children. And they're on to different topics because they've realized that what they're saying doesn't stand up to the millions of experiences that mothers like me have had with their children. It just doesn't hold any weight anymore. So it's not trendy for them anymore. So now the aromatherapists are joining doTERRA because they've realized they better plug into the new way. And again, I applaud aromatherapists who educate and have for decades prior to this movement happening, incredible pioneers, right, within this. However, what they're teaching on safety and usage, of course, absolutely, you do not take essential oils internally if you don't know what you're taking. But they're not working with the pure source oil. Some of them might be working with micro companies that have some good oils. But again, that transparency is not there. So aromatherapists for sure had to do that work. You're also going to see, like I said at the start of this broadcast, the resistance is going to pick up. There's going to be a lot of resistance to this change because it's going to move fast. But you need to really anchor into what you know to be true. You need to, again, when this starts to happen, dial up your own personal responsibility even more so that you are a walking, talking example of what happens through this lifestyle. I cannot stress that enough. This is the most important thing as we move into this next wave of growth, okay? So let me hop up. I know you have some questions. If you're on my team, I'm going to be going into our leader group at 3:30 today, just sharing some more specifics that were shared at leadership that would not pertain to this group at large. I felt that this was the most important conversation for today. Was, wow, how cool to see this kind of change happening and happening fast. And I know we can all think of people in our life who are desperate for solutions and desperate to be heard. And this is the kind of care that we've been wanting, right, for a long time. So it's coming and it's so exciting. It's so exciting. And I'm so, man, I'm just so honored to be a part of all of this. It's such a beautiful thing to see taking place. So if you guys want to stick around, we'll do a couple questions here. So first question, hold on one second. I see Jill has uploaded. Just want to make sure I'm on the right show questions. Okay, here we go. First question was any and all info on Prime Meridian, please. Okay, we talked about that a lot today, right? So the actual website, you guys, is pmhclinics.com. So if you want to hop over there, you can read more about what I talked about. Second question, beyond leading ourselves first and showing up for our community, how can wellness advocates best step ahead into this movement and lead the way? That is also what I just finished talking about, right? So great, segue into this question was, how do we best step ahead and lead the way? We lead ourselves strongly. Again, I want to remind you, the next time that somebody is sabotaging your work or talking about you behind your back or judging what you stand for, all you have to do anymore is look at their life. Because that's all anyone else is going to do is look at yours. But if they want to know, are you an example of what's possible? That's what we need to stand for, guys. That's what it means to be a leader in this movement. Honestly, can we just say gone are the days of people posturing themselves and saying there's something when they're not? There's a lot of that curated world going on today with social media, but at the end of the day, people can feel that from you, right? They know if you are an example of what you're teaching, and that's what it is required of us to be a leader today in this movement. And this is why I say there are some people who quit because they weren't the right people. They will go on to do other things, which is great. Wish them well. But they were not the right people to take the level of ownership needed in order to be given more, in order to lead this movement. Someone said, I've heard you say before that you feel it would be irresponsible to share the actual research around essential oils and treatment for disease. The reason I have said that before, you guys, is because I sell doTERRA. I cannot responsibly hop on here and say, use this for this disease, or use this for that, when the FDA wants to make sure that that's their playground, using prescription drugs. That's what I mean by that. It's truly up to you as the consumer to do your research with all that's out there, right? You have access to it all. And we give you a lot of access to ways to further your own knowledge and education when you join, but I can't publicly come on here and say, use this for disease, okay? And that's what I mean by taking responsibility in the right way. It would be easy for me too, right? But I want to raise you up to expand in your awareness and realize that there are many other ways out there. Instagram, we lost you. I know you can't hear me. Let me just click save. We've gone over an hour. See what happens when I'm only on monthly? Okay, one sec. We'll share that up for them. Can you go live in twice in a day? I can't remember. Forget it. They can join us on Facebook. Let me just see. I want to keep the questions today related to, somebody asked what kind of coffee maker I use. Yeah, I want to keep the questions related to this topic today, but I did share that on Instagram yesterday, you guys. So live people, we have a couple hundred of you on live. I just want to scroll through. Brandy said, I was sad they didn't want acupuncturists like me, but I understand that the work needs to happen with MDs. Initially, Brandy, it's very important that these facilities have medical doctors in each of them first. Now, they will expand to have other holistic practitioners in-house, but for this initial opening phase, it's going to have to be MDs. Hey, Meg, she said, do we have to be a member of your doTERRA team to be part of the cleanse in April, like your February one? No, I have 2 cleanses that I run. Ready, Set, Glow is the one happening in April. It's open to anybody, any team, anywhere in the world, okay? Scrolling. Oh, I don't know about that. So Best Essentials Masula said, if we don't have access to a local clinic, will we be able to participate remotely? Okay, so I know they're doing telehealth and email plans, right? So I'm just not sure of the pricing and how that would work, but I will certainly plan on doing it for myself, just so that we have that type of access to a doctor, even if I can't go in physically see them. I'm just not sure if that's gonna be ready right away, but I'm sure the website would answer that. Hey, Katie, she said, I think it still feels so unbelievable for so many of us, since it's not at all what we're used to. It's incredibly exciting to start to hear about people's experiences at the new clinics. Yeah, exactly. I'm so excited for that. Robin said it's huge, not only for the cost, but for what this provides. Yeah, big time. Okay, just reading through these comments, see if there's any other questions. Katie said, as a former ER nurse and lifetime client of the conventional healthcare system, this speaks to me so profoundly. The system is so broken, and this is healthcare as it should be. Yes, actually, we had a breakfast when we were in San Diego with one of my teams, and we had 3 of the women around the table at breakfast are nurses and work within the local healthcare system, and they are doing amazing things locally. And I really feel nurses, not all, but the majority of nurses have been really committed to this for years. They've been kind of, underground, really trying to influence change within this area because they see it all, right? They see it all. Okay, yeah, let's wrap this up for today. How do we wrap that up? All of that to say, if you are someone who has doTERRA in your home, I want to encourage you to put those oils to work. I want you to commit to furthering your own knowledge and education to really understand what those bottles can do for you in your home. If you're somebody who has been waiting, you've been hearing about essential oils for years, and you've passed them off thinking, whether they're overpriced or hype or fancy marketing, this is really the time to reconsider that. Just because, you know, what are we waiting for? If you're truly waiting for research and case studies and all this, it's going to come in a couple years, but is your health worth more than that to you? Is it worth it to you to feel better in your body sooner? Because again, there are millions of people who are examples of what this lifestyle does. I think it's just like, when is the right time to feel better? That's really the question, right? And the last call to action I would leave is for those of you who are medical doctors, those of you that you want to come back to why you started. This is an opportunity for you to do that and to really be part of, I mean, something new, something exciting, but something that we're going to look back at in a decade from now and think, wow, look how much things have changed because of that timing, you know, that time frame. So really exciting stuff. Let me just check our calendar. I will be back with you guys April 24th, Wednesday, April 24th. That will be in Ready, Set, Glow week. So maybe we'll have some conversation around actual rituals that help to cleanse the body and help us shift state. I love the timing of this one because it's spring coming. The sun is beaming in my office, as you can see here. But I'll be back then with you guys. And before then, I'll release a couple of micro episodes, like I mentioned, on the topic of finances. If you are doing your taxes just like me, get her done, sister. Just get her done. Get her done and then take yourself out for massage. That is what is on deck for me on Friday. All right, you guys, bye for now. Hey, thanks for tuning in to today's show. If you liked the content, please consider popping over to iTunes and leaving a review so that more people can find this show. If you have a question or a topic suggestion for future shows, head over to wholefit.com/pod question. You can also find all past episodes and show notes at wholefit.com/podcast. See you next time.